if somebody paid me to do stuff, but for now I have no conflicts. And again, this is essentially what I said prior, and then the standard disclaimer for any healthcare provider is that your attendance does not construe any kind of healthcare relationship establishing care, etc. And again, this is meant to be an overview and provide practical, applicable ways you can help yourself. This isn't meant to get into the mechanisms, all the other stuff. I've done that presentation. That's an entirely separate existing presentation. If that's something people really want in the future, is the science and the things that kind of make your eyes glaze over when you're at medical conferences. But I've got plenty of it. And then obviously there's no one size fits all in anything, medicine is in particular. And so there will be things that I may talk about that might not apply to you for your health. A good example is, people who say everybody should drink more water. Well, that's fine unless you're in heart failure and that could kill you. Or I'm sure you've heard about radio contests where somebody chugs water to win, a PS4 for their kid and dies from water toxicity. So even things that are considered common sense don't apply to everyone. So for me, I tend to be a high information person. And so it's hard for me to pare down ICU levels. So I've sort of designed this to have more pictures and information. I think it's more visually appealing. I think it's easier to, get a lot of high value information in a small area. I promise I didn't just fill this with pictures to show you while I talked. But it's really important because this is a leading cause of death. And what many people don't necessarily realize is that Alzheimer's is a terminal illness resulting in death. There are other kinds of dementia, of cognitive decline that don't necessarily lead to that, but ultimately you will die with Alzheimer's disease unless you die from something else first. And it's expensive. It costs our healthcare system trillions of dollars. It costs our families, our friends, our communities, our hearts, a whole lot of time, money, and anguish. So I'm guessing by a show of hands, has anybody in here had anyone they know, love, care about, deal with any kind of cognitive decline besides me? Okay, so vast majority. I figured I was among friends, but I always like to feel the room at the beginning, just to be sure.
Can I ask you a favor?
Sure.
Those of us with hearing loss are having a hard time. If microphone going,
sure.
Slow down a little bit. Keep your head up.
I will do my best. And they're gonna get me a microphone. It's funny you should bring up hearing loss, which is to come. I'm a native East Coaster. This is me talking slower, but I'm working on it. It's taken me a long time to get here. I appreciate you bringing it up in the beginning, so thank you. We'll back up in here, but I'm getting there.
So what was your name again?
My name is Erin. Nice to meet you. I'm Dr. Erin Weaver. And some interesting things in terms of statistics, actually. I'm afraid to move this, but no,
And listen in.
There's some interesting factors. Alzheimer's happens twice as likely in women than men, like many things, including during COVID. Men were much more likely to die from COVID. Women are much more likely to have long COVID as an example. And so what you'll see with many chronic illnesses, not just cognitive decline, is that men are more likely to die. Women are more likely to be disabled and have long-term issues, and that includes Alzheimer's.
Okay, well, this drinking hazard, so it's not good. We need to adjust it up right now.
Better. Do this up, or I will run into it. I know. Never been to open mic night, and there's a reason I don't sing karaoke. All right. So, one of the questions,
I need to turn the mic just a little toward you because it needs to catch what's coming out of your mouth. Catching the ceiling right there, like that.
all right,
That work now?
sure.
Better.
Play shots now on whether or not I knock this over at some point during this presentation. Or an end of it. I would bet on you doing that. So one of the questions I get asked quite a bit is about, what's normal in terms of memory loss? Oh, I forgot where I put my keys, or oh, I'm sure I'm not the only person in this room who has walked into a room, forgotten why you walked into that room, and then turned around and walked back into the room you came from, only to repeat the process 1 to 12 times, and then 4 hours later, remember why you were trying to go into that room. So what's normal, what's not? Memory loss occurs, and cognitive decline occurs on a spectrum. So, and it starts much earlier than the signs are noticeable to most people. So, for example, it's a spectrum that ranges from, in terms of diagnostics, it ranges from what we call mild cognitive impairment, and then to different forms of dementia. And then Alzheimer's is the most common form of dementia, but there are other types as well, like vascular dementia, which you see with people who have had strokes, with people who have heart disease, high cardiovascular risk, diabetes, things like that. So the scope of this is not to go through the different types, although I will touch on them a little bit. But the range is what's normal, what's not. And most people are shocked to find out that cognitive decline is actually not a normal part of aging. Memory loss is not a normal part of aging. You are not guaranteed to die with, a loss of memory of some kind. Now, there are changes in your brain that can happen that lead towards, again, I am 43 years old and I walk into a room and forget why I'm there. I am not in mild cognitive impairment. I am not in the early stages of dementia, but who knows, when I look back in 20 years, maybe I was. So it's really hard to have foresight for something that is insidious and develops over time. And so, what I've got here comes from, I like infographics because it's easy to summarize, but it's, a lot of us, I think, if you look at this list, have had a struggle or two with at least one of these items, right? How many times do we forget what we're doing? I had a panic attack once in college because I forgot how to spell the word who, and I was 20 something. So we all have moments where something doesn't work right, or, we get glitchy. It's really common as well when we go through major life transitions. Like any postmenopausal woman in here, I'm sure can attest that things are different and how things function after, you go through major metabolic changes, cognitive changes, hormonal changes, and with age and growth. So personality changes are also not normal. I've heard plenty of older married couples say, it's just I've been with him for 50 years, so I tolerate him, but he's ornery or whatnot. But it wasn't always that way. And I think oftentimes, we fail to recognize subtle changes in the people we see every day, right? A great example, most of my family lives back in the Midwest. I'm a native Ohioan. And so I'll go home, all of my siblings have children who are small, and it'll be, wow, you guys have gotten so big. And the contrast is dramatic because I haven't seen them in a year or 6 months. Whereas yes, their parents know they're growing, but they don't see them every day. Right? And so sometimes it's hard to be subjective or to be objective, I should say, when you're too close to something. I met a woman recently who is a retired bank teller and told me a story about a husband and wife couple who would come into her bank, and she had a long-term relationship with them. And one day the wife came in by herself and was struggling. And because of this long-term relationship, she ended up mentioning it to her husband next time she saw him, and he had no idea. And so sometimes it's those peripheral people in your life, but who are part of your life, that are first to notice. And so don't be afraid to ask friends, neighbors, people who are close, but not so in it that you can't necessarily see it or take a step back out of it to recognize it. The other thing that's incredibly common when, somebody is that close to you is denial. Because nobody wants to believe or feel like they're slowly losing the person they love the most or who is closest to them. And it's all of us have avoidant behaviors. So this is something I'll commonly see as people get closer, or it gets too close to them and it's too hard. So, keep that in mind. Don't be afraid to ask. Oftentimes it's the children who no longer live with mom and dad who will bring it up. And it's never an easy conversation, but it's really important to keep that in mind because it takes a village, as you will see. So the neurologists like to sound fancy when they talk about things. This is the least neurology fancy sounding imagery I could find. But again, there's different factors and there are other illnesses, other things that overlap with these symptoms, right? Anybody who's ever been depressed, been through hormonal issues, has small children, has been sleep deprived, works split shifts, has dealt with difficulty concentrating or paying attention to things, or selective hearing loss, So some of these symptoms, and that's what makes it really challenging for diagnosis, is that there are so many different symptoms that overlap and look like other things, right? And again, because nobody wants to go first to dementia or that thing that is, I think, in many cases, we are all the most scared of developing. Nobody wants to feel like they're losing themselves. And anybody who's watched someone go through that can attest to how incredibly challenging and heartbreaking that is. So, it's important to consider those things and to, consider that when you talk about it, when you see your own doctor. I cannot tell you how many patients are afraid to bring things up, or, the other thing that's really, really common is that people mask. Anybody, even people with severe dementia, well, okay, we'll step back from severe, but many people with Alzheimer's disease, other forms of cognitive decline, are able to keep it together long enough to get through a 20-minute doctor's appointment. So counting on your physician or the physician of your family member to magically catch everything when they get so little time is challenging. That's not to say it is our job to recognize those signs and those symptoms. But when, in most cases, and especially here locally, it can take months to find a doctor, and then your healthcare provider leaves, and then, it's like a merry-go-round. It's very challenging to have consistent care here in any small community, but here in particular, at least from where I've worked and in my career. So, keeping that in mind, it's also challenging for healthcare when you're told you get 7 minutes with a hand on the door, you've never met someone. I can attest, and on behalf of any healthcare provider you have ever seen, I would like to apologize. There's not a single one of us who I know, okay, maybe some of the surgeons, but they're like the engineers of medicine with no social skills. Nobody believes that that's good care, and none of us want to be forced to provide that to you. So trust us, we know. And it's really frustrating to us too. So I want to put that out there. on behalf of everybody else, because I think it's really important in what I've seen the members of this community go through. So dementia, as I've sort of mentioned, is a catch-all. It's an umbrella phrase that includes the different kinds. Alzheimer's is the most common, the most prevalent. Then the vascular form again, which comes with risk factors for cardiovascular disease. Anybody having had a stroke is one of the criteria for vascular dementia, for example. And then the frontotemporal dementia you often see with pretty significant personality changes. For example, when you think about football players who end up raging with chronic traumatic encephalopathy, and then become violent and aggressive, or people who go through dramatic changes that are marked from who they were. Sometimes you can see that with severe traumatic brain injury. So that's a form, those types of illnesses or injuries, I should say, often lead more down that pathway for people. Lewy body dementia, you commonly will see with Parkinson's disease, both separately or together, and as hallucinations happen quite a bit. The other part about this is that, and then there's, infectious causes, HIV, syphilis, meningitis. You can have different inflammatory conditions, and it's going to be really interesting to see in the next few years and over the next 10, 20 years what COVID is going to look like. There's been brand new research coming out that they're treating the herpes virus family may actually help prevent dementia, and that your brain has its entire own microbiome separate from your gut. And that viral and fungal infections actually may play a role. So there's some pretty cutting edge, really exciting research, going on. And it also leads towards, I think, an even greater ability to help prevent this for yourself as we learn how working with your gut microbiome, working with your digestion, working with things you can control, helps modulate and moderate those risks. So, as I mentioned, there are lots of things that can look like lots of other symptoms. One of the big things I would like to highlight here is that the number one symptom of a bladder infection, of a UTI in an elderly person is actually confusion. Acute confusion. So if you have someone that's, with delirium, so if you have someone who, and then you have somebody who has Alzheimer's with a UTI, how challenging can that be when you have behavioral changes? So, it's important to also note that, older people often don't mount fevers. They don't have, they have weakened immune systems. So some of these things, it's really important to compare to baseline, because Alzheimer's dementia is something you're going to see across time versus, they were okay, and then the next day they're angry, ornery, out of it. It's easy enough to rule out a UTI, which is really important to do. And they also have a much higher risk of ending up septic with sepsis. When you have incontinence, when you're wearing diapers, when you have, limited mobility, limited ability to change yourself, to care for yourself, it actually can be a gateway to a downhill decline pretty fast and resulting in hospitalization, other things. So I want to make a plug for that, because a lot of people are like, they're doing it again, or grandpa's just mad today, so important to consider. And then going back to the hormonal piece, thyroid is really, really important. That's what regulates your metabolism. And then it's often common. It also is what often will slow down postmenopausally, and men go through andropause. You guys have your own version of menopause. People don't talk about it, but you do. So, with dwindling testosterone levels, that can happen, and resulting in, not just decreased muscle mass, but confusion as well. But your sex hormones, progesterone, estrogen, testosterone, all play a role. And they're also big players in that thing I mentioned at the beginning, with women being more likely to develop chronic illness, autoimmune disease, and men being more likely to die from acute illness, which is actually sex hormones. Sex hormones have a very large role to play in that. The other piece that I want to make a plug for is medication. Medication. There's something called the Beers criteria, which is a set of criteria, a set of, things you go through like a checklist. And what oftentimes happens is you've been prescribed, let's say you've been prescribed medication for your blood pressure when you were in your 50s. And then over time, your kidney function gradually decreases over time. Your liver function changes, and the vast majority of all prescription medications are metabolized by one of those two things, your kidneys or your liver. So that 20 milligram dose you got at 50, more often than not, I see people need less medication, not more, as they age. And part of those side effects from, medication interaction, medication dose, can result in confusion and cognitive decline. So one thing that is incredibly important is to review your medications, to ask those questions. And some medications on their own have known side effects of, brain fog, cognitive issues, and most people over the age of 65 are on 5 or more medications of different classes and different types. So when you consider all of those things, and that's not counting, if you have underlying fatty liver or metabolic disease, diabetic kidney illness, that kind of thing. So it's really important, and I advocate, please bring your bottles of medication and any supplements to every doctor's visit you ever go to. Because we can call the pharmacy and have them tell us what you're taking, but it's not always correct. The other thing is that people often think that supplements are harmless because they're natural. That's also not the case. And so there's plenty of interactions that happen among herbs, botanicals, vitamins, things that are cofactors. And there's also processing pathways for, through your liver, your CYP pathways. If you're on only 3 medications, but they all go through the same pathway and you take them all at the same time of day, that can create some problems. Sometimes helping symptoms improve is as simple, relatively speaking, as separating out dosing, or maybe you're supposed to take it with food or without food, and those things haven't changed. So, fun pro tip, thyroid, calcium, and iron are all absorbed by the same receptor. So anybody who's on thyroid replacement, it needs to be taken on an empty stomach first thing in the morning, not with your almond milk or your regular milk or milk in your coffee. You can get away with black coffee, although I did not say that out loud. And iron, you need at least 3 hours away from iron supplementation. So for example, I always have patients take iron in the evening and calcium at lunch or midday. But the many patients I've seen who have been hypothyroid for decades have never been told about that. And then it's not that they need more medication, it's that it's counteracted. If you're taking a multivitamin that's the kitchen sink, it's got everything in it. You only have a handful of receptors that absorb all of those things. So you're not necessarily getting what you think you're getting. And it's the same thing with your medications. So sometimes it's not even that the dose needs to be lowered, it's that they'll raise it, thinking that, okay, well, it's not working. Well, it's not because you're not taking it. It's because you're not absorbing it, or you have counteracting things happening simultaneously. So that's a plug for medication that I think is really important, that doesn't get talked about enough, that does relate to this topic. The other thing I want to make a plug for is we have quite a few patients in this community who have been through bariatric surgery of varying kinds, and they're required to do a lot of workup, prior, before you, undergo surgery. They check your vitamin levels. I cannot tell you how many I have seen who have never, or maybe within the year after, had their nutrient levels tested. And I've run labs, and the vast majority are deficient in fat-soluble vitamins, other things. And so what looks like cognitive decline can be something like B12 anemia, or you have vitamin D that is abysmally low. So as much as these, oh my gosh, I'm experiencing memory changes, I'm having these issues, sometimes they really can be relatively straightforward fixes, or there are things that can really make a big difference, if you can correct those things, then see what's left. And then it's easier to differentiate what is truly dementia, what is truly mild cognitive impairment, and what's more along the lines of Alzheimer's. Because realistically, it's a clinical diagnosis. It requires autopsy and slides. I'm the child of a pathologist, so I hold them near and dear. I was the only kid I know who had to go to the morgue when I was little and had the flu. Because you didn't go to work with dad who had live patients. So, they're near and dear to my heart. I've spent more time in a morgue than a human should, who is not a pathologist. But that's how diagnosis actually happens. And it's, posthumously done. So you're not going to have a confirmed diagnosis. We've done a lot of work with biomarkers, and interestingly, the modifiable risk factors that I'm about to talk about, the most recent research is showing that regardless of your ApoE status, which is one of the big markers we talk about, these risk factors can decrease your risk of developing dementia by up to half, regardless of your carrier status, which is a pretty big deal for families and people who, have Alzheimer's within their family history, within their family tree, or who are carriers. And in terms of genetics, I think one thing that's also important to point out is that just because you're a carrier, it's like a light switch. You have a gene. Let's say you have the BRCA gene for breast cancer, right? You're a carrier. Something has to happen to flip that light switch on. That's where environment, that's where other outside factors. So just because you carry something, genes are like light switches that are turned on and off by interaction with your environment, with other factors. So, which is the field of epigenetics. That's what we're talking about when we talk about epigenetics. So it's not fatalistic. There are a handful, if you have a sex-linked illness, there are a handful of illnesses that are, sex chromosome linked. So you inherit it, you've got Huntington's disease or Tay-Sachs. There are certain, those types of illnesses, but they're few and far between comparatively. So lots of people will say, and you may have a higher risk of that light switch being turned on, but that's not a death sentence. I once had a patient who was a marathon runner. He was a vegan, super healthy. He dropped dead at 45. His family history had severe cardiovascular disease. And he said, his wife was talking to me and she's like, well, that was a waste of his time. He still died early anyway. And so I sat there for a minute and I said to her, or maybe he lived longer and would have dropped dead 20 years ago with those risk factors. So it's important to think about those factors you can control in that way, because we're not good. We are not good at waiting. We are an instant gratification society, 100%. Dopamine, guys, your cell phone, all of it. And we are more and more dependent on that, the more and more technologically, dialed in and hooked we are. So it's really important to keep that in mind as I talk about what's coming, in that and the nice thing about it being a marathon and not a sprint is that if you have a bad day and it doesn't work out, you decide to have pizza and beer followed by cake and hot wings and, fire burrito and then hate yourself for a week. It sounds like Thursday, yeah. So, it doesn't have to be perfect. Perfect is the enemy of good. Take it from somebody who's a recovering perfectionist. And so it's important to keep in mind that these changes are incremental over time. And so it's easy to feel like they're not doing anything or they're not helping you. But it's like, again, when I go home for Christmas, my niece and nephew have gone from here to here, even though it's gradual for mom and you don't see it. Ask your kids, ask your friends, ask people you haven't seen or don't see regularly when they come and you spend time with them, because that's telling. So think of this as an investment, it's a return on investment. So what are the modifiable risk factors? First, there were 10. The Lancet, which is one of the premier medical publications in the world out of the UK. The Lancet in 2017 they do a publication. They have a joint commission that does updates. They do meta-analyses, systematic reviews of all of the most recent research. Updated, they screen for, top quality, all that. And then they summarize. Did not get over that. They summarize the status of the research to date. They did it in 2017. Then in 2020. This was just published in 2024. This came out at the very end of July in terms of this graphic. And they've changed it over time. In 2017, there were 10 factors. In 2020, they moved to 12. Now in 2024, they've added 2 new factors, which are high LDL cholesterol and vision loss or vision impairment. So lots of these, and I include an air pollution and toxic exposure, which I think is really important. Anybody who's ever been in the military, anybody who's ever worked at a mill, anybody who's, worked. I had 9 car mechanics, all diagnosed with non-Hodgkin's lymphoma in the same year, same form, from the toluene, the benzene, the exposure. So I think we think about air pollution, we think about Beijing, we think about Mexico City, we think about, we have pretty nice air here compared to a lot of places. But when you think about air pollution, I want you to keep in mind toxic exposure, because in our environment, I think that's much more prevalent and much more insidious. I used to live in New York City, and the joke, which is actually true, is that everybody is on Prozac and birth control from the metabolites of medication in the water supply. So, there's different ways of toxic exposure kind of coming into things, heavy metals, lead paint, and then with smoking, it's terrifying to me that doctors used to smoke during visits, and you could smoke on planes and in bars and in cars and with your children and everywhere, and was that because people didn't care? No, they love their children. Knowledge changes over time, right? You can only deal with where you're at now. I'm sure there are things we do now that in 20 years, we're going to look back and be like, God, we were barbarians. I mean, I've never done an ice pick lobotomy, so we've come a long way in a short period of time, right? Well, I think if you look at this list, it's also important to realize that a lot of these things are common. How many times has a doctor harped at you about your blood pressure, or to quit smoking, or to lose some weight, or all those things, right? And you're annoyed because you're like, yeah, if it were easy, I would have done it already. I don't believe in fear-based medicine, and I don't believe in patient shaming, because the secret to breaking habits or things that don't work isn't fear. It's figuring out what you want more than what you're currently doing. It's positive reinforcement, not negative reinforcement. So, all of that being said, I'm sure there are people in this room who have some of these risk factors. I have some of these risk factors. And I would like to think I take pretty good care of myself. So, I think it's also interesting if you look at groupings of these risk factors and you see some commonalities. I recognize some themes and some patterns that if you were to break this list down and rearrange it differently, you could group these into some subgroups and some subheadings or some overarching themes that run through many of these things. So, audience participation. Which one of these 14 factors has the single greatest impact in changing the world and reducing Alzheimer's, dementia, all of it across the board? Which one do you think is the single, if you only did one of these interventions, has the single greatest impact over time?
Physical inactivity.
Nope. Nope,
Hearing loss.
Social isolation.
Nope.
Alcohol.
nope,
Depression.
nope,
Sex.
nope. It's a good one though. No, it's actually education. Educational attainment.
What is on this?
And if you think about it, it makes sense.
Huh.
Because what they've found with education, one, it's the only thing that starts at the very beginning. This is the first time the Lancet has stratified these factors on a timeline. And education is the only one that starts early life and goes throughout life. And what comes with education? Learning, knowledge, stimulation, intellectual challenges. And interestingly, they've done plenty of studies where somebody who's been college educated can start even with neurofibular tangles, the beta amyloid plaques. If you were to dissect their brain, the things you would find in somebody who passed with Alzheimer's are there. They don't show actual functional symptoms for up to 10 years because of that difference. And in a time where, I know when my grandparents grew up, in a time where women weren't allowed to wear pants to work. I mean, let's get real here. It's not like we've had equal opportunities of the genders across time, even in the recent past. It comes down to increasing your cognitive reserve, which, interestingly, for people who find their work stimulating and enjoyable, can mitigate low educational attainment more than, the brain games, the training, the other things. What they've found to be one of the best mitigating factors, and it's education of less than 8 years. So we're talking just getting to grade school and junior high. In other parts of the world, many people don't ever even get there. So a lot of this research, they've divided up and stratified between high-income countries and low-income countries because it's such a dramatic difference. And that education truly is the great equalizer when you really think about that in terms of opportunity, in terms of exposure to new ideas, things that are intellectually stimulating. And keeping those habits throughout life is protective. So if you're a reader, if you like puzzles, if you crochet, you knit, you were the dorky kid who read your childhood Encyclopedia Britannica set, you liked the library, you went out, you talked to other people, you learned to program when you were 12 because you were bored and hated school. I mean, there's all types of ways that finding an interest in something and maintaining intellectual curiosity across your lifespan will serve you better than, taking your statin, which you should take with food in the evening.
Say that again.
I didn't say anything. I didn't say anything about that. But yes, consolation. So social isolation also goes with this, which will come up. That's from, if you were going to bookend it at both ends of life, education and social isolation are those bookends. So New Zealand, they make kind of cool graphics. I like this one. I've seen a lot of that aren't that. They're a little overdone and kind of difficult to understand. So looking at these from a visual place, these are those risk factors. We talk about obesity, we talk about being overweight. Plenty of research has shown that BMI as an index isn't really that helpful. Just like IQ testing over the age of 8 really isn't that helpful in a lot of ways. And there's also different kinds of intelligence, to be fair, And the interesting thing about the vision loss is that they're finding that it's one thing to need readers, to have to, wear glasses when you drive, people develop cataracts, we have much better access to eye care in our country, even though I think it's ridiculous that you have to have separate dental care and eye care, but they're all part of your body For healthcare, yeah, you know. And if you can't see, it's hard to read, right? It's hard, you can't drive. Why do you need to drive? Well, to do lots of things, because our culture is not set up for walking in most places. You need to be able to read labels, to take your medication, to, do much of anything, to communicate, right? We have 5 senses for a reason. If we didn't need it, it's like our vestigial tail. Want the way, I mean, maybe one of you guys has one, but I haven't seen one clinically yet. I will tell you if I do that. So if you think about those things, same thing with hearing loss. How many times have you talked to somebody and they're like, what? Or you just assumed they're ignoring you or not paying attention when literally they cannot hear you. I am the child of an oral surgeon, my dad, and a grandchild of an oral surgeon. And using dental drills their whole life, their whole career, that high-pitched whirring results in hearing loss. I was concerned. I went home for Christmas, in the recent past, and my dad seemed off to me. And it took realizing that he couldn't hear completely to make a change. Now he has hearing aids that have like Bluetooth, and don't ever go on a 16-hour car ride with somebody whose hearing aids are Bluetooth and connects to their stereo. They'll sing at the top of their lungs and you get serenaded in a way you never, ever wish for to have happen once, let alone ever again. So, but think about it. Hearing, and for every 10 decibels of hearing loss that you experience, that's a 6% increased risk of dementia. They're actually doing studies now, and with the research coming out showing that an intervention as simple as providing hearing aids to everyone who needs them and making mandatory vision screening and hearing screening, not just as a punitive thing where they take your driver's license away or, when it's bad enough that now you're beyond the point of, it's severe, you're at cochlear implant point, you're at a point where you can't get your hearing back. Because the other piece is that intervening on these things early makes a huge difference. Plenty of patients will say, yeah, I know my eyes are a little, but I don't know, vision insurance, or they'll pay for the eye exam, they won't pay for the glasses. But the time is a heck of a thing. When we're doing things we love, we never have enough of it. When we're struggling, it can't go any slower, right? But as the previous thing shows, this happens on the timeline. And the earlier you intervene along your life's timeline, the more you reduce your risk. And it's not an inconsequential amount. So, in lieu of infographics, and I think to make this something you guys will understand, we've now reached the point of this presentation I lovingly title A Tale of Two Grandmas. And this presentation is dedicated to them. This is Mary. Mary is the daughter of Polish immigrants. She is married to Walter, that handsome gentleman there. Walter was a friend of Mary's older brother, and Mary worked at the draft board during World War II and met Walter that way. They got married in May of 1948 and had 3 children. Grew up, lived in Detroit, Michigan, in and around the era of automotive boom, industrialization, all of it. This is Ruby. Ruby grew up. She was born in Dayton, Ohio, but grew up about an hour outside. They moved to the country, to a more rural area. She married Richard, that dapper guy right there. They got married a year later in 1949. Richard was a retired Navy radioman who served in the Pacific during World War II. Walter served in the army during World War II and had been a cabinet maker. He actually hand-built the topography map that Eisenhower used to build and plan Operation Overlord for D-Day. These guys, that is Jim and Sue. That's how I came to be, AKA mom and dad. I don't know how old this picture is. My Aunt Carol gave me this morning, and it's my current favorite thing. This is me with those people, just to prove I didn't make this up or pull these off the interweb. I was born in 1981, on the same day as my grandma Weaver. My grandma Boldus was born on the 11th of January. My grandma Weaver was born on the 18th of January, and I was due on the 13th. So one wanted me to be early, and one wanted me to be late. So I guess I got the memo. Common themes. Common themes. So as I got older, both Ruby and Mary graduated high school. Ruby took some extra secretarial classes. She and Richard, she married an oral surgeon who, at that time you could have a one-income family. They liked to dance. She learned to golf. She enjoyed swimming. She raised 4 children. My dad was the oldest. And had a very comfortable, what I would call upper middle class life for that time and place. As she aged, she developed mitral valve prolapse, which is a heart condition involving a heart valve. She had a lumpectomy, and at one point was diagnosed with kidney cancer and had a kidney removed. She was healthy enough to live with 1 kidney. And up until later in life, when she became ill and developed what we call pulmonary hypertension, which is increased pressure between your heart and the side of your lungs, because your kidneys actually regulate and mediate your blood pressure. She was otherwise a lovely, spunky, wonderful woman who lived to the age of 82. She liked to knit. She was very social. She would always, she didn't have any hearing loss, but which I think is a common, insert husband's name there. For many people, that's a common theme people have seen. Was thin and in good shape. Even when she passed, she was a normal weight. She smoked socially back in the day when everybody did it, during dinner parties, cocktails, but she was never a long-term smoker. And yes, my grandfather smoked in the house. So there's all secondhand. I feel like everybody who was alive during that time probably has some degree of secondhand smoke exposure as a long-term risk factor. She was never obese. She was a social drinker. Alcohol wasn't really an issue. She lived in good air. She had completely normal hearing up till the day she died. She dealt with episodic depression every so often, but what didn't really struggle with that as a long-term thing, was never diabetic, no brain injuries, no anything else. And she was part of a community that she loved. She was an avid volunteer. She did a lot of things that, wrong way. That is Ruby. That's Jones. Mary grew up in poverty as a child of Polish immigrants. She was the only girl. She had 4 brothers, an alcoholic father. She never drank a day in her life. She never smoked. Wasn't diabetic. She walked to see all of her friends or rode a bike. And even in growing up, my mom used to talk about having 2 pairs of shoes, one for church, one for everything else. Grew up in a close-knit community, but in downtown Detroit, in Hamtramck, in the Polish Village. Was a normal weight, almost all of her life until postmenopause and developing pretty severe arthritis where it was hard for her to walk. She taught me how to play Scrabble, and she was vicious. So, and not diabetic, no brain injuries, had high cholesterol, had high blood pressure. And in terms of polar opposites, she never went to the doctor. Ever. Didn't want to go. She didn't see a doctor until her 70s after my grandfather passed away from non-Hodgkin's lymphoma. She finally went. And a cardiologist found her heart condition. She had rheumatic fever as a girl, which led to rheumatic heart disease later in life and her high blood pressure, but was never diabetic. And was a very stoic, but very loving woman. Ruby had access to good medical care, went to the doctor, took care of things. And so 2 different approaches, 2 very different women, 2 people who I loved very dearly, who both happened to die at the age of 82. So common themes with these risk factors. The thing that jumps out to me with all of these is inflammation. How many of these conditions are pro-inflammatory? And the removal of them lowers your inflammatory burden. I know inflammation, I stopped at the natural grocers here to ask the person who does their presentations what they get the most questions about. And he said, by and far, inflammation is the number one thing. She's like, you should do a talk on that. I was like, I could teach a year-long course on that. But then it was brain health and heart health. Those are the big ones locally, at least for the people who shop at natural grocers. But when you think about inflammatory risk, which of these factors can you group into inflammation or being pro-inflammatory? Alcohol, smoking, high cholesterol, air pollution, obesity, and lack of movement, because you're not clearing. You have 3 pressure systems in your body: high pressure, low pressure, no pressure. High pressure, that's your arterial system. You have arteries that have their own smooth muscle and pump to circulate your blood. Veins, you have valves. So things can't backflow, but it's why at the end of the day, your legs swell or your feet swell. Then you go to sleep, you bring them up, and it'll go away in many cases. And then you have your no pressure system, which is your lymph. And that moves based on mechanical movement. Hence, needing to move your body, circulate. Your lymph carries your immune system, it carries nutrients, it carries all sorts of stuff. And very importantly, it helps remove toxins and waste from your body to be processed and eliminated. So those factors with go into obesity. And the more weight you're carrying, the more you swell, the more physically inactive you are. That all contributes to living in an inflammatory environment internally. Head injuries can create all sorts of altered processing, anything in a large enough quantity could cause inflammation. There's actually a form of depression called inflammatory depression. It's very commonly seen in people with autoimmune illness, people with things like lupus, with psoriatic arthritis, with any kind of long COVID, Epstein-Barr, chronic fatigue. Those things are all, you're inflamed, that those same factors contribute to being depressed. So I think inflammation as a broad category, if you think of it, in some ways outside the box, or take a step back and directly think about it, can be linked to many of these. Stress. How many of these things are stressful? I don't know anybody with hearing loss when they finally realize you're talking to them who isn't embarrassed or who doesn't struggle or who doesn't have a hard time and feel worse because they can't engage. And then if they live alone, that's even more isolating. Imagine if tomorrow you woke up and were blind. How much would your world change? Or if you couldn't hear, how much would your world change? It's a bigger deal than I think we think about, especially if you don't deal with it yourself. Even for people with ringing in their ears, tinnitus. With tinnitus, over 90% of people with ringing in their ears lose hearing for the frequency of their ringing. There's only a small percentage of cases where if you go through hearing screening, people will still hear at that tone or frequency. That's the same where there are hearing losses. High-pitched hearing loss is more closely related to the damage to the hair cells in your ears. Low pitch often has a vascular relationship. So any one of these things, if you woke up tomorrow in Beijing and your hair was black, I would be afraid to breathe. You know, they're going through traumatic brain injury and you wake up not knowing. That's a true story. I was in a head-on car accident and almost died my first term of medical school, 8 weeks in. Traumatic brain injury, a bunch of other injuries. I was told by a neurologist that I should probably drop out of school and be a checkout girl at a grocery store because people with my type of injury don't regain cognitive function. I wouldn't have known making soup that I was making it unless I had a card that was like add water, boil carrot, and I could see a carrot in the pot. My vision was messed up. I have 20/15 vision, but my eyes didn't work together. So the ceiling would become the floor would become the ceiling, couldn't watch TV. I spent 8 months sitting and watching a bird feeder with my dog in the backyard. You know, you don't realize how hard any one of these things are until you're faced with it yourself. And so I think when we step back and look at the members of our community who struggle with any one of these things, it's really important to keep that in mind. You know, there before the grace of God go I, right? We're lucky to be here, we're lucky to be alive. And just like I, after an 8-month leave of absence, graduated medical school after a year longer than it took. Top of my class. I'm stubborn and I'm a Capricorn, and that's what we do. My odds aren't normal, but here I am. And I think it's really important to know that none of these things have to be a death sentence. Or if you are diagnosed, it doesn't mean that your life ends or that things magically fall apart, but it's really, really important to consider the other common thread that I think is arguably the most important in all of these things, and that's community. They have done, if you've ever seen, there's a TED Talk by Robert Waldinger. It's one of the top 15 most watched TED Talks of all time. And he's I believe the 5th or the 6th director of the longest running study on human development, all of that. It started at Harvard in the 20s. And it's the point that they've now watched grandchildren, their children, grandchildren, blood levels, scans, images, everything. And what they found is that the single greatest deterrent to developing cognitive decline and then kind of falling off at 80 is the quality of your relationships at age 50. Think about that. Just like I said earlier, it takes a village. What happened to our village? We don't know our neighbors. We're ridiculously expected to raise a family, run a household, go to work, do everything on our own. You know, some people live in multi-generational households. We don't know our neighbors. Between a decline in community clubs, religious attendance at various churches, social organizations. And social isolation does kill. Just as insidiously as anything else. So it's really important to reach out. I would argue that preventing cognitive decline can be as simple as picking up a phone and calling a friend you haven't talked to in a while. Checking on your elderly neighbor who struggles. reaching out to somebody you know having a hard time. I have an agreement with my best friend because when I struggle, I can sometimes throw quiet. And my agreement is if she sends me something, I'll send her an emoji. I usually pick some random flag, so she has to figure out where it's from. But that's me saying to her, I'm alive, I'm okay, I'm just going through it. And it can be really hard and really challenging to support people who are depressed, who are struggling, who are immobile, who are disabled in some way. So think about that and think about what you're going to want for yourself when your time comes. Because there's more people in the baby boomer generation than there are children to take care of them. And I don't think it's a surprise to anyone that we have a massive shortage of healthcare providers across the board, even more significant in memory care and caretaking, caregiving. So think about what you would want for yourself when you struggle and pay it forward. So, my grandmas. Thinking about those 14 risk factors, this is how it lines up. Ruby liked to knit. She did it as a hobby. Mary crocheted prolifically. Interestingly, she was blind in one eye and never told anyone. Had a cataract in the other, my Aunt Carol found out when she took her to the doctor for glasses in her 70s. We always wondered why she didn't like to drive. She never said, we have no idea when she ended up blind in one eye. But my guess is that it happened much earlier, just based on history and piecing things together than we knew. She was crocheting the morning she passed away. Barely able to see. She kept herself busy after my grandfather passed away by deciding she had no idea how many grandchildren or great-grandchildren she would have. So she went on a tear and knitted Afghans like there was no tomorrow. And slippers that you wear on a wood floor and immediately slip because there's zero traction whatsoever. So, which grandma died with Alzheimer's and dementia and which didn't? What do you think? Based on these risk factors. It's hard, right? We've all got some. They're very similar in a lot of ways.
Yes.
Sure, please. Show of hands. How many of you think Mary was the one who died with Alzheimer's? How many of you think it was Ruby?
About both of them.
No, I made it so it wasn't a trick question or it would really make people not. Yeah, I try not to make my audience angry. That's a general rule, especially for your community debut. Ruby died with Alzheimer's. That is Ruby and Richard and my dad and me and my siblings and my uncle Dave's. Third one? She passed away with Alzheimer's. And at the end of her life, she remembered her 4 children. She remembered my mother. And I was the only grandchild she remembered because I was born on her birthday. You know, we talk about dementia and, one sign or symptom of cognitive changes. You notice they start telling the same stories over and over again. They often start talking about when they were younger, in childhood. I had a friend whose mother had dementia that got pretty severe, and her father was taking care of her at home. And she would get very flustered whenever he would have to leave the room. So he and their children recorded a CD of just general chatter and them talking that he would turn on. So she didn't think she was alone. And it kept her calm. My best friend in the world. We've been best friends since we were 13. Back in Ohio, she's the youngest of 6 children. And she came home one day to find her mother trying to open a wine bottle with a butcher knife. Literally. Her father had passed away, had dropped dead after accepting an award in the parking lot years earlier. And her mother was a retired ER nurse, worked the night shift, smart woman, accomplished, somehow raised 6 kids, had a ton of grandchildren. And it wasn't until that moment when she walked in and realized just how much her father had been covering for her mother for all those years. And looking back, now they can see the signs. She ended up, when her mother had moved into assisted living, buying her childhood home and living there. And as she was cleaning it out, she found handwritten notes from her mom hidden all over the house with their birthdays written on them, with her wedding day written on them, with important information written on them. It came to a head when they realized she couldn't live alone anymore, when my best friend showed up and her mother had a black eye and had no idea how it happened. Started having accidents. When she went to help her mom change the dishwasher, she found dirty dishes in the oven and molding food in the dishwasher. Her mom, had been a social drinker. The number one missed group of alcoholics is actually retirees. Because, you don't have to get off work. 5 o'clock is any o'clock when you need it to be. Or they have social clubs. They do social things. And she liked red wine. She wasn't, drinking a bottle of vodka every day or hiding things. Her daughters, including my best friend, they had 1 bottle of actual red wine and then replaced the other ones. They opened it and dumped in non-alcoholic wine, resealed it, and so she never knew the difference. But alcohol is actually a very, very big problem among older people, especially who come from an era where social drinking, social smoking was normal. They saw their parents do it. They like to host parties. They like to entertain. And that's not to say, I feel like daily the research changes on, red wine's good for your heart. It's bad for your heart. You're going to die if you drink red wine, but if you drink coffee, you'll be okay. It changes, anything in moderation. But she started falling down, started being injured. Didn't know why. Didn't know what happened. Couldn't account for it. They put up cameras in the house to try to figure out what was happening when she was home alone. They did all sorts of things. When they finally decided that it wasn't, and that's the other thing. It takes a while to get somebody into assisted living or memory care, if you can at all, where you live. They assessed her, put her in memory care, and they had to have her reassessed because the people there were in wheelchairs and kind of catatonic, what you think of. So had to be taken out. You can actually live in assisted living with dementia, that is not so impaired that you can function. I asked her and my dad today what they wish somebody would have told them before going through this experience. And it's hard. You can never be prepared. And it is heartbreaking to watch somebody you love more than anything slowly disappear. Since her mom's diagnosis, she has had a little girl. Her mother doesn't know her daughter, even though she brings her. One of her siblings goes every day to see her. And even in a facility, they still have to bathe her. They walk her to lunch. They do all of those things. So going to a facility doesn't equal full care. So when you think about that, it makes it a little bit easier to be motivated. When I talked about the way to change habits is figuring out what you want more. I would argue that most of the people in this room want something more than that for themselves at the end. For me, that's motivation enough to do what I can to reduce my risk now. This information comes from the CDC, from the Alzheimer's Association. There's lots of different resources. That's me. Thank you for paying attention, for having questions or 1 minute. And I did not go to the microphone. I got against myself. Do I have money to? So the question is, can you have a talk about Parkinson's disease or diabetic vision losses? Definitely. Parkinson's, we have a high occurrence of neurologic disease in this community. There's also, we have a much higher rate of prostate cancer, renal cancer, other things here locally. It wouldn't surprise me if the chromium plant that was once in functioning during, World War II or whatnot. And then why can't we allow death with dignity? In Oregon, death with dignity is legal. So that is something you have to have a different licensure, that kind of thing to do it. And death with dignity with Alzheimer's is a different topic. You run into the issue of consent. You run into the issue of informed, how do you negotiate with somebody? The one thing, my best friend said as well is that have the conversations now, even if they're hard, even if it's going to hurt or be hard for your family member to hear. Because powers of attorney, there are so many things to get in order if you know it's coming. And most people in active love is letting them make those choices for themselves while they still have the ability to do so. Don't be afraid to ask your doctor if you think something's happening, to go with them to an appointment, to, advocate for them. Everybody deserves to have somebody advocate for them and go to bat for them. And I would argue that this is as good a topic as any to help out a loved one with. There's also early diagnosis is crucial because that gives you access to resources. For anyone who does in-home caregiving for a loved one, Medicare reimburses at 3 times the rate for caregivers who care for people with Alzheimer's who have diagnosed dementia than they do for other illnesses. So there are, other ramifications of that. Oh, okay. Is there a way to incorporate the Oregon Death with Dignity law with late-stage Alzheimer's? I don't know. I don't know the answer to that, but that's a really interesting question. And I think it's at the crux of do no harm in terms of being a medical provider with what's humane and what do you have the ability to choose. So that's a great question. I don't know the answer to that, but I'll probably go home and look that up and see what I can find. And if I find anything, I will let you know. Natural cures. There is not the easiest thing I can say about natural cures is this. There is not a pill on earth, an intervention a doctor can give you, a surgical procedure, physical therapy. There is not any of that can out-medicate, out-treat, take care of not eating, not hydrating, not sleeping, not moving your body, not breathing, not eliminating. It's not sexy. It's the stuff we do every day. And that's why it's the hardest thing to change. And put it in perspective, I once had a patient start sobbing because she was upset she hadn't eaten kale. Like the kale was out. And she was like, I can only eat kale, carrots, and other things. I was like, Did you kick a puppy in the parking lot on the way in? Have you punched a baby? You're doing okay. You know, moderation. It's not gonna be perfect, and that, the good news is it's a race. You know, it's long term, that timeline's long. So you have all the time in the world to make mistakes, not get it right, struggle. It only takes 72 hours for nicotine to physically clear your system. For the physical addiction to nicotine, the average person's psychological addiction to nicotine can take up to 7 years to overcome. So, got time, doesn't have to be perfect. I appreciate you guys being here and your questions, and I will check these out, and I hope to be able to talk to you guys again if that's something you want. Thank you.